Toronto's Board of Health is meeting today, and on the agenda is an update on the respiratory virus season.
CP24's Courtney Heels is following that live from City Hall. Courtney, good afternoon.
Good afternoon, Lena and Bakari. And many wondering what the overall picture is when it comes to influenza and respiratory virus activity in the city of Toronto. This update came from the Associate Medical Officer of Health, hearing that we are seeing high levels of respiratory virus activity in the city, but also seeing influenza levels are decreasing a bit. To talk more about this, let's bring in Dr. Dina, who is the founder of Kid Crew, also a pediatrician in Toronto. Dr. Kulik, I'll start by asking what you're seeing in your clinics right now.
Good morning. Yes, lots and lots of viral illnesses for sure for the last few weeks. Lots of COVID, lots of influenza. Most cases, we don't know what the actual diagnosis is, but many kids are having fever and runny nose and cough, stomach flu symptoms as well.
Does it seem as though some of the viruses are taking longer for the patient to get better? I know I've been hearing that from some people, even just from some parents saying that, you know, seeing fevers that aren't just lasting a couple of days, it can be almost a week in some cases.
Absolutely. We've seen that a lot. So many kids that we're seeing that have fevers for, 5 or more days. Many people, kids and adults with coughs that are lingering sometimes for weeks or months as well. This can be from COVID. This could be from influenza, RSV. Many viruses can do these same things in terms of long-lasting symptoms.
Is it encouraging to hear, according to the City of Toronto update at least, that it seems as though influenza levels are decreasing a bit?
For sure. I mean, I'm hopeful that we kind of have burnt out this particular virus, but viruses come and go over viral season, and it's still quite cold outside. We're indoors. We are mostly unmasked in most cases, and therefore things can still spread quite a bit over these winter months.
Let's talk about what parents can do or what they should watch for, because for parents, it can be quite concerning to see a little one get sick, and sometimes they don't know when they should reach out and get some help.
Very important, of course. So babies less than 2 months of age, if they have any fever at all, 38 degrees rectally, they should go to the emerge right away. Don't give any medicines or anything. We want to check the temperature and treat them accordingly. For other children, even babies, if they have fever, it's always a good idea to touch base with your healthcare provider, family doctor, pediatrician, and we can examine and make sure that there's no bacterial infection. And I always recommend to reassess kids with fever every few days if it's ongoing. So, 2 or 3 days later to see if anything else has come of it. Of course, if your child has difficulty breathing, if they're not able to drink anything, if they're losing consciousness, this is also a reason to go to the emergency room.
Dr. Kulik, last question, very, very quick. I know we're seeing a lot of viral activity in the city of Toronto right now. What are you seeing the most of in your clinics?
Most of the time, we don't know what the actual virus is because we don't have the ability to test everyone. But I suspect a lot of it is COVID and flu, mostly with respiratory symptoms like runny nose and cough, fever. A lot of cases we're seeing now of pink eye and stomach flu as well.
Dr. Kulik, thank you for your time this afternoon. We appreciate it.
You're welcome.
Okay. We can also tell you, Lena and Bakari, an update on the outbreak situation involving influenza and COVID right now. 75 COVID outbreaks in the city of Toronto, 15 influenza, 9 RSV, and these are active outbreaks in healthcare settings. Over to you.
Okay, CP24's Courtney Heels live from City Hall. Courtney, thank you.